Do you want a straighter smile, but you're afraid of the discomfort and hassle of traditional braces? Well, you're in luck, because today we're going to talk about the fastest growing dental procedure in the world. It's the revolutionary orthodontic treatment that is changing the game in dentistry. Yes, we are going to talk about clear aligners. So what are clear aligners? In this video, I'm going to dive into a comprehensive overview of what this procedure is, how they work, what benefits they offer, and why they might be a great option for you or your loved ones. So what are clear aligners exactly? Clear aligners are a set of plastic trays that are custom fit to your teeth, and they gradually move them into the desired position. They're virtually invisible, they're comfortable to wear, they're removable. All three of those are great reasons as to why they could be phenomenal alternatives to traditional braces for you. Now you might be wondering, how do clear aligners actually work? Like, it's just plastic on teeth, right? Yeah, kinda, but there's a little bit more to it. So when you're moving teeth, it is all about force, and you want to apply force over a certain period of time. Let's compare this to braces just for reference. So traditional braces where you're using brackets and wires, those are going to apply forces onto the teeth to move them. These brackets are glued on and attached to your teeth, which are then connected to wires, and your orthodontist tightens those over time to gently apply pressure onto the teeth to move them into the position that they need to be in. Clear aligners, on the other hand, are removable plastic trays. Like I said, they fit over the teeth and they apply force to different teeth at different positions at different points in time. The force is constant and gentle, and this helps move the teeth. Like I said before, these aligners are custom fit to your teeth, so you're able to get really precise movements. While both aligners and traditional braces can be great options to move your teeth, they do apply force in different ways. Clear aligners are going to be applying a more gentle, consistent force, while traditional braces are going to be a lot more concentrated. And then that concentrated force can be adjusted by the provider who's doing your braces. That force that is being applied to your teeth can impact the speed and the extent of your teeth moving. This gives braces the upper hand because there is a lot wider variety of cases that braces can treat. All that being said, this must be regulated by a healthcare professional, specifically an orthodontist or a trained general dentist. Because if you put too much force on the teeth and they move too fast, you can actually cause irreversible damage to your teeth. This is not good. On the other hand, if you don't apply enough force to the teeth, well, then your teeth aren't gonna move. This is one of the many factors that come into play when you're moving teeth, and it is a good idea to make sure that you are under the care of a certified treating professional. These are gonna be your general dentists who have taken additional training in aligners, or an orthodontist who has also taken training in aligners but also does brackets and wires. Orthodontists do go to school after dental school while they are specializing in orthodontics, so that's something to note. But like I said, if the general dentist is trained in this procedure, they are more than equipped to handle a certain number of cases. It may not be as extensive as an orthodontist, but a trained general dentist can do straightforward procedures. All right, let's get back to the aligners. So when you get aligners, you're gonna have a set of them, maybe 15, maybe 20, and each set is gonna be worn for a specific period of time. I have my patients wear them 22 hours a day. That means they take them out whenever they are eating, and I have them wear each tray for 1 week. When that week is finished, they move on to the next tray. When they are done with aligner therapy, we make them retainers, and they wear the retainers for life. Yes, I mean that. You have to wear your retainers for life. Reason being, your teeth have ligaments that attach all around the tooth. These ligaments are connected to the bone. So when you're born, your teeth have a natural position that they are supposed to be in. That position is not straight for everybody. So when you do any type of orthodontics and you move your teeth, those ligaments now get stretched out, and that's totally fine, because if you wear a retainer, the retainer will keep the teeth in that new position and fights that force of the ligaments, which are trying to snap back to the original position. So as long as you wear your retainers at night, you don't have to worry about your teeth shifting back to their original position. But if you don't wear your retainers, your teeth will shift. I guarantee it. And then you got to go right back into this cycle of wearing braces or doing aligners again. So what's it going to be? Okay, let's talk about some benefits of aligners over braces. So with aligners, they're hardly noticeable, and you can actually straighten your teeth without anybody really noticing. And in today's day and age, if you're still wearing your mask, even better. Aligners are also comfortable to wear, and they don't require as many adjustment appointments that traditional braces do. A lot of those tightening appointments with braces can be super painful, so that is something that a lot of patients do complain about. Not to mention, when you have braces on your teeth, that is metal, and it does cut up people's lips from time to time, so you better make sure that you're using that Vaseline or dental wax. Either one works. My favorite benefit about aligners is the fact that that they're removable. This means that you can move your teeth, and while you're in treatment, you can actually take your aligners out, eat a meal, brush and floss, and then put your aligners back in. So I find that with so many of my patients, when they actually go through treatment, they come out on the other side with healthier teeth. When you have braces, you have a wire that is going between all your teeth. So yes, I get it. There are different tools and brushes that you can use to clean in between your wires and your teeth, but people are lazy. So a lot of patients come out with a lot of plaque and gum inflammation and just not as clean of a mouth as they do if they were to do aligners. Now, one more point of oral health. If you have aligners, you have to be brushing and flossing every time before you put your trays back in. If you don't, think about it. You have small spaces between your teeth. So when you eat your meal, food can get caught in those spaces. Then if you don't brush and floss, you can put your aligners back in. Now all of a sudden you've trapped that food in between your teeth. So bacteria swarms to the site. This is how people can get cavities after going through aligner therapy. And it's not because of the aligners. It's just because the people weren't cleaning their mouths. So to wrap it up, clear aligners are an excellent option to move your teeth if you qualify for treatment. They work by applying a consistent force to your teeth. They're virtually invisible, and they have a bunch of other benefits over traditional braces. Like I said, not everybody qualifies for aligners. You have to see a trained general dentist or an orthodontist to see if treatment will be right for you. But I thought this video would be helpful for you so that way you know the difference between aligners and braces. I hope you found this video helpful in understanding more about aligners. If you have any questions or comments, please drop them below. Also, don't forget to drill that like and subscribe button for more informative videos like this one. Thanks.